This award for Maximising Resources for Success acknowledges AHP leadership from across the UK for service redesign and improving patient support and outcomes. This year, all 3 finalists for this UK award come from here in Northern Ireland, and I'm exceptionally proud of that. First up, we have Caroline Greer, a specialist speech and language therapist from the South Eastern Trust. Caroline has utilised specialist speech and language therapy skills and put in place the first parallel ENT SLT clinic in Northern Ireland. Well done, Caroline. Next up, we have a duo from the Belfast Health and Social Care Trust. Cheryl Mackin, a dietitian, and Carly Brown, a radiographer. Carly and Cheryl have together improved patient experience and outcomes for patients undergoing head and neck cancer radiotherapy. A fabulous initiative. Well done, Carly and Cheryl. Finally, we have Suzanne Kennedy from the Northern Health and Social Care Trust. Suzanne, a physiotherapist, has improved physiotherapy care pathways, ensuring that patients referred to the Regional Spinal Orthopaedic Clinic have improved access and improved outcomes. Suzanne's project has demonstrated how allied health professions can work to improve services across Northern Ireland. Well done, Suzanne.
Hi, my name is Caroline Greer. I'm a specialist speech and language therapist working for the South Eastern Health and Social Care Trust in Northern Ireland. I specialise in the area of ENT and work with patients who have got both voice and throat conditions. The Speech and Language Therapy Lab Parallel Clinic runs in the ENT department next to the ENT Doctor Clinic. It is led by an advanced practitioner speech and language therapist who carries out the full examination in place of the doctor, including a nasoendoscopic evaluation of the larynx. Following consultation, the case is discussed between doctor and therapist and a diagnosis made, and the therapist can then talk to that patient about their recovery and the management of their condition. We feel we have improved the efficiency of our service, and we've had excellent outcomes. In the first year alone, we have managed to discharge 90% of the patients we've seen off the ENT waiting list. 75% of those patients seen have not required follow-up speech and language therapy input, and we've reduced the waiting list within that first year by almost 80%. We feel that the clinic is more sustainable, there are less visits to the hospital by the patient. We feel that this is transformation at its best. We feel that we are maximising the skills and strengths of both the speech and language therapist and the ENT consultant. And yeah, we're excited about the future, we're excited about what else we can develop. We've had great feedback from our patients as well.
Hi, we're the head and neck team from the Northern Ireland Cancer Centre here in Belfast. I am Sarah Jane, specialist dietitian. On the first balcony we have socially distanced Carly, specialist radiographer, and on the second balcony, socially distanced Cheryl, specialist dietitian.
So why did we decide to enter the IH Awards? Well, it was because we seen it as an excellent opportunity to share our experience of the benefits of close interdisciplinary working and how co-production can streamline resources whilst enhancing patient-centred care.
So our project involved setting up a new outpatient NG feeding service for patients, head and neck cancer patients who are receiving radiotherapy. Due to the extreme toxicities experienced with treatment, our aim was to maximise nutrition support at the earliest opportunity through the initiation of NG feeding. The patient training aspect of this project equips the patient to take ownership of this element of their care and enables them to remain at home where they can be fully supported by their families during a very arduous treatment journey. And that in turn helps to then reduce actually the number of inpatient admissions and overall bed days.
Hi, I'm Suzanne Kennedy and I'm a physiotherapist for the Northern Health and Social Care Trust in Northern Ireland.
Hi, I'm Kim Hamilton. I'm the Orthopaedic Assessment Service Manager in the Northern Trust. We provide a service for a wide range of orthopaedic conditions. We have a multidisciplinary team and we provide a service across a large geographical area.
Historically, our orthopaedic waiting times have been incredibly long, particularly with spinal patients, with these patients waiting up to 4 years to see a spinal consultant. So we had regional discussions on how to address these long waiters, and we initiated and piloted a telephone assessment clinic, which was very successful, with most of the patients being discharged. So we scaled this up and developed a telephone assessment service for these spinal patients.
To enable us to do that, we had to invest in our IT system and in our telephone system. We developed virtual clinics with new virtual clinic codes on our patient administrative system, and we trained all of our staff in how to use that.
So of the 1,800 patients that we dealt with, only 3% of those were returned to the surgical spinal waiting list, and we managed the rest of those patients within our service.
So bearing in mind, Suzanne, this was all pre-COVID.
Yes, we were well ahead of our time, but we have to remember that this was a new way of working and it had a significant impact on the waiting list, and that's one of the reasons why I entered the team for this award, because I wanted them to be recognised for this work.
The team worked incredibly hard throughout the project in both the development and the implementation of it, and I really feel it contributed to the success of it, Suzanne.
Absolutely.
I'm delighted to announce Suzanne Kennedy as the winner of this award. This is a good example of how physiotherapy services are able to support my department in restructuring and reform of orthopaedic services. So congratulations also to Helen McGinn, who has been recognised as a rising star.
Congratulations to Suzanne Kennedy, Team Lead Physiotherapist, for this outstanding achievement. I'm delighted at the role that physiotherapy has had to play in the transformation and in the restructuring of services and in gaining this acknowledgement. We here in the Northern Trust are extremely proud of what she has achieved. Well done, Suzanne.